lawyer.
Yeah, and you see, that is actually the narrative that the politicians are pushing. That, look, these healthcare workers do not want to be closely supervised, they don't want to be under devolution. And that's a wrong narrative, because we were actually centralized when we were devolved. Yeah. When we were under national government, we were actually supervised even most regently. We had systems that would supervise you up to the sub-county and will report all the way back. And if you remember very well, we never used to even have shortage of supplies in our hospitals as we do now. But before I lose that thought that Ms. Keller was talking about, you know, you wonder why the county governments continue to cling on to this money. Mm-hmm. Why should you be a broker? Mm-hmm. You are given money to pass to Olive. Mm-hmm. How do you benefit? And the reason as to why counties do not want to release this money is because they must be benefiting in some way. Mm-hmm. And in their benefiting, they're actually hurting Kenyans. Mm-hmm. They are hurting provision of healthcare services. When they go into these banks and get an overdraft and get a loan, you have to pay interest. Then when the banks are paying, they don't pay for deductions. They don't pay for your payee, for your NHIF, for your loan deduction. They only pay the net pay. Hmm. So you are still late to pay your deductions and whatever you are supposed to pay for your loan. When this money comes to the governors, they are going to pay the interest. As they pay their payee, they are also going to pay a penalty to KRA, a penalty to NHIF, and to the others. But there is no money added on top of that by the national government for them to pay the interest and the penalties. So who suffers? The development budget for healthcare services, to build infrastructure, to purchase equipment, to buy reagents, to buy essential supplies like drugs. So you have this never-ending cycle of challenges created by a very simple fact. That there is this money that is supposed to be paid to Olive, but we have to give to Ms. Keller first so that he can give to Olive. So why can't we then have a centralized way of paying salaries? And that does not affect devolution. Why can't we have an account for salaries for devolution that brings together the 47 county governments so that when Treasury pays, then everybody can be paid at the same time so that they do not have actually to suffer? Now, when it comes to whether we are in denial, you remember before we went for devolution, we had a protracted strike. And I remember then we were told the train had left. I don't know where the train was going, since I know you were talking about Kenya and it couldn't go beyond Kenya. And a conversation about health is a very important conversation that we should have as Kenyans. What we were asking for is that we have no problem with devolution. And the idea of devolution was very good. Those people who had a vision of devolving healthcare services, they actually wanted to bring universal health coverage and closer to that Kenyan down there, and especially to the marginalized areas. But then we knew that there was no proper framework to ensure that there is effective management of health human resources. Mm-hmm. And that is what we are asking for. That please, can you delay this a bit? We create systems to ensure there is effective management of human resources for health, and then we can go into devolution. But then we were forced down into the devolution. And that is what we are seeing now. A county like Kisumu, for the last, I think now would be 6 years, heading to 7 years, this problem of salary delays has been there. And for so many other counties. What we can say about our health service today is that it's actually not working. There is probably no dispensary or health center, leave alone the level 4s and level 5s, because they know that there is a lot of limelight on them. In this country, if you go to any dispensary or a health center, it is very difficult to get essential supplies and especially to get drugs. The result to a common Kenyan is that the cost of getting these health services goes high. And how does that happen? When you come to me as a clinic officer in a health center, and I want to diagnose you, I will probably send you for some lab works. Those lab works are not available because we don't have reagents in the lab. So I'll send you out to a private laboratory. You're going to pay more. Then when I give you a prescription, you're also going to purchase these drugs from a chemist that is outside the hospital, which you are also going to pay more. But what baffles me even more is that when you see a slight challenge in the education sector, the public will be up in arms. The Twitter will be blowing up. But when people are even dying from a failure in the public healthcare system, we do not see Kenyans come up and complain the same way. And I think that is where we actually do have the problem, because for the politicians, as long as the electorate, as long as the person who gives them the vote, because for them they follow their vote, is not complaining, then the politician is not going to take any measures. And that is why I have been saying that it's about time we have a law or a regulation somewhere that if you are an elected leader in this country, you must procure your public services, not only health, from education, from transport system, from health. You should be able to procure those services from your local area where you have been elected. So that by doing that, then we will force them to focus and ensure that systems are working down there so that it can favor themselves. You remember a case of an MCA in Nyeri who died in a health center. And it was very unfortunate. I'm not saying that it's a case we should be able to celebrate. It's very unfortunate. You also remember the case of the governor for Nyeri, that they found themselves in a position where they wouldn't be airlifted to their preferred private hospitals there where they could be managed. And they landed in the nearest public health facility. But unfortunate for them, there were no equipment, there were no expertise in some of them where they could be able to actually manage them and offer the emergency services they needed so that they could survive. And they died. And so it must be seen that it affects all of us. And the only way to show that it affects all of us and to make them feel that they are also threatened is to ensure that they consume the same services from the locality where they represent.
Okay. So I need to take a break, but I will